So hello guys, today I'll be covering chloramphenicol and aminoglycosides. So for chloramphenicol, you need to know, remember it like there is a baby, name is Ram, okay? Ram. And why I told you to remember it as baby, because chloramphenicol, so this is your ADR for chloramphenicol, grey baby syndrome. For what is grey baby syndrome? If chloramphenicol it is given in high doses to the newborn, there will be vomit and he would refuse the feeds. Like if mother would try to feed him, he would show refusals. Okay, there will be hypothermia, metabolic acidosis, as newborns cannot metabolize chloramphenicol. So that's why there is a grey baby syndrome that occurs. Okay, and this baby is always cranky, he just cries a lot, so there is hypersensitivity, like if anything happens to him, he just cries, he's just a cry baby. Hypersensitivity, rashes and fever. There is because due to his crying, he's also facing depression, which is the bone marrow depression. Okay, bone marrow depression. There's also gastrointestinal disturbances like nausea, vomiting, the typical ones, and there's also super infection. Super infection because he is a super baby. That's why I have made him in red underwear. Okay, super infection. And it binds to 50S. If you want, I have a trick prepared. So how do you have to remember if a certain drug is 50S or the other one? So moving on to the uses साठी you need to know ki like for uses, you just imagine this baby has a younger sibling. He or she just complains to his mother that I tab bagtoy. So I is mother, he is watching tab. And riktoy, okay, riktoy is some word, random word. Okay, so I is for eye. Uses for eye, topically good penetrates into the aqueous humor. Okay, tab, as we know, whenever I say tab, it refers to typhoid fever. Typhoid fever. Baktoy is bacterial meningitis. Okay, bacterial meningitis, meant for as he is a boy, bacterial meningitis. Okay, anaerobic infection. Ricto is what? Rickettsial infection. So I tab बघतोय आणि रिकतोय. Eye infection, typhoid fever, bacterial meningitis, anaerobic infection and rickettsial infection. So one exercise I would suggest कि after knowing these tricks, just practice it and actually try to solve MCQ. Actually just try and solving those MCQ. You will know how tricky those MCQ can be. Even though you know the whole topic, you will need some of these tricks so that you know for sure ki haan baba, this is the option that I should be marking because this is the correct, that you are sure. You don't have to be confused among the two. Okay, chloramphenicol. Now moving on to aminoglycosides. So as when your professor has discussed these topics with you, one thing that they would specify, and you will also remember that autotoxicity, aminoglycosides causes autotoxicity. Okay, so you will just remember it as there is an auto. Okay, auto, aminoglycosides, autotoxicity, amino, and behind this auto there is a kidney. Okay, because he had to sell, his auto wala uncle had to sell his kidney to buy this auto. So there is nephrotoxicity, neuromuscular blockade. Just remember this, neuromuscular blockade, and there is autotoxicity. And just read it, like why autotoxicity actually happens. Okay, so it is just so interesting to, if you know this, you can actually prepare or you can actually write something. Okay, So you are done with this. So actually I have completed both of these, chloramphenicol and aminoglycosides. So yeah, so from next time I'll be covering the CNS or CVS mostly. Yeah, that's it. Thank you. And actually just try it for yourself if it actually works. Let me know. Bye bye.